America is grappling with a devastating epidemic touching every corner of our nation. It's a story of despair and loss. This is the story of America's drug epidemic. The numbers are staggering. Every day, hundreds lose their lives to drug overdoses. Behind these statistics lie real people, now lost to addiction. The epidemic respects no boundaries. It affects people of all ages, races, and backgrounds. The face of addiction is diverse, reflecting our nation. We see it in the young athlete whose future is cut short by an opioid addiction. We see it in the single mother, struggling and finding solace in methamphetamines. These stories share a common thread: the devastating impact of addiction. The roots of this crisis run deep, entangled with poverty and mental health issues. Overprescribing painkillers has fueled an opioid epidemic. The rise of synthetic drugs like fentanyl has led to a surge in overdose deaths. This epidemic is not just about drugs, it's a public health emergency demanding our attention and commitment to finding solutions. Behind the statistics are real people whose lives have been forever changed by the grip of addiction.
I excelled in school and dreamed of becoming a doctor, but a car accident left me with chronic pain, leading to a dependence on prescription painkillers.
Sarah's story is not unique. Across America, countless individuals and families are grappling with the devastating consequences of addiction.
I lost my son to a heroin overdose. My grief is palpable, my voice trembling as I share my son's story.
These personal stories bring the statistics to life, reminding us that behind every number is a human being. Despite the bleak reality of the drug epidemic, there is hope. Communities are coming together to combat this crisis.
Innovative treatment programs are emerging, offering hope.
Law enforcement agencies are shifting their approach. Programs like LEAD connect individuals with treatment.
Grassroots organizations provide vital support. The road to recovery is long, but with support, recovery is possible. To understand America's drug epidemic, we must journey back, tracing events that laid the foundation for this crisis. The Harrison Narcotics Tax Act of 1914 marked the beginning of America's war on drugs. This act aimed to regulate opiates and cocaine but laid the groundwork for drug criminalization. The 1990s saw a surge in opioid prescriptions like OxyContin, marketed as safe. As prescriptions skyrocketed, so did addiction and overdose rates. What began as a solution to pain became a public health crisis. Millions initially prescribed painkillers found themselves addicted. Misguided policies and aggressive marketing created fertile ground for the epidemic. The overprescription of painkillers in the 1990s and 2000s opened a Pandora's box, unleashing a wave of addiction that continues to plague communities.
Pharmaceutical companies, driven by profit, played a significant role in fueling this crisis. Their aggressive marketing campaigns led to a dramatic increase in prescriptions, flooding communities with these highly addictive drugs.
Doctors, often pressured by patient demands, became unwitting accomplices in this tragedy. The pain as the fifth vital sign movement further contributed to the problem, leading to a culture where opioids were often seen as the first line of defense.
As opioid prescriptions soared, so did addiction. Many turned to heroin as their tolerance increased and access to prescriptions became difficult. This shift marked a dangerous escalation, with heroin often laced with deadly substances like fentanyl.
The overprescription of painkillers created a ripple effect, impacting individuals, families, and the healthcare system. It exposed a critical lack of oversight within the pharmaceutical industry, highlighting the devastating consequences of prioritizing profit over public health. The legacy of this era continues to haunt us, reminding us of the importance of responsible prescribing practices and the need for greater transparency and accountability. A new and even more potent threat emerged: fentanyl. This synthetic opioid, up to 100 times stronger than morphine, infiltrated the drug supply. Fentanyl is cheap to produce and easily transported, making it attractive for drug dealers. Its danger lies in its potency and ability to be laced into other drugs without the user's knowledge. Heroin, cocaine, methamphetamine, even counterfeit pills are often laced with fentanyl. A single dose, even a minuscule amount, can be fatal. The rise of fentanyl has led to a dramatic surge in overdose deaths. While the overprescription of painkillers ignited the firestorm, the roots of America's drug epidemic run deeper, intertwined with societal issues. Poverty, lack of economic opportunity, trauma, mental health disparities, these factors create an environment where addiction can flourish. The stress of living paycheck to paycheck, lack of access to quality education and healthcare, and generational trauma make individuals more susceptible to substance use. Mental health plays a significant role in the epidemic, with many battling undiagnosed conditions. Addressing the drug epidemic requires a holistic approach, recognizing these complex societal factors. In the heart of Appalachia, nestled amidst rolling hills and once thriving coal towns, a different kind of struggle is unfolding. Here, the opioid epidemic has cast a long shadow, ensnaring generations in a cycle of addiction and despair.
My name is Jessica, and my story is like so many others here. It all started with a prescription for painkillers after I got hurt at work.
The opioid epidemic, fueled by economic hardship and overprescription of painkillers, has hit rural communities like Appalachia hard. Despite the challenges, glimmers of hope emerge from the darkness. Local organizations, often staffed by volunteers who have battled addiction, are working tirelessly to provide support and resources. The ripple effects of addiction extend far beyond the individual, leaving families shattered and communities grappling with the aftermath. In a quiet suburban neighborhood outside of Chicago, we meet Eileen, a mother whose world was turned upside down by her son's struggle with heroin addiction.
My son Brian was a bright and promising student. He started experimenting with drugs in high school, just a teenage rebellion, we thought.
Eileen recounts the harrowing journey of watching her son transform from a vibrant young man into a shadow of his former self, consumed by the relentless grip of addiction.
The sleepless nights, the frantic calls to hospitals and treatment centers, the constant fear that each day might be his last. It's an agony no parent should have to endure.
Eileen's story is a poignant reminder that addiction does not discriminate. It can afflict families from all walks of life, tearing apart homes and leaving behind a trail of devastation. On the front lines of the opioid epidemic stand first responders, the men and women who witness firsthand the devastating consequences of addiction. We meet Officer Johnson, a veteran police officer in Baltimore, a city grappling with high rates of drug overdose and addiction.
My beat takes me through neighborhoods ravaged by the epidemic. Every day I see the human toll of addiction.
Officer Johnson's days are filled with a mix of tragedy and resilience. He responds to overdose calls, administering naloxone, the life-saving overdose reversal drug.
I see the desperation in their eyes and the heartbreak of families torn apart by this crisis.
Yet Officer Johnson also sees glimmers of hope. He witnesses the transformative power of recovery as individuals find their way back to health.
Programs like Law Enforcement Assisted Diversion, or LEAD, connect individuals with addiction to treatment and support services. We recognize that addiction is a public health issue, not just a criminal justice problem.
Amidst the despair and devastation, stories of hope and resilience emerge, reminding us that recovery is possible. We meet David, a young man who, at the age of 19, found himself caught in the grips of heroin addiction. His journey began with prescription painkillers, prescribed following a sports injury. What started as a way to manage pain quickly spiraled into a full-blown addiction. David's turning point came when he discovered a local boxing gym that offered a unique program for individuals recovering from addiction. The discipline and camaraderie of the boxing ring provided David with a sense of purpose and belonging. Through the support of his coaches and fellow boxers, David began to rebuild his life, one punch at a time. David's story is a testament to the transformative power of hope, resilience, and the importance of finding purpose in the face of adversity. While the opioid epidemic presents formidable challenges, communities across America are rising to the occasion, demonstrating extraordinary resilience and compassion. In the heart of Philadelphia, a city grappling with high rates of drug overdose, we witness the power of community-driven initiatives to combat this crisis.
Organizations like Prevention Point Philadelphia are providing a lifeline to individuals struggling with addiction, offering harm reduction services such as needle exchange programs, overdose prevention, education, and access to naloxone.
Local churches and faith-based organizations have also stepped up their efforts, providing food, clothing, and counseling services to individuals and families impacted by addiction. They offer a message of hope and redemption, reminding those struggling that they are not alone in their journey. The fight against the opioid epidemic is far from over, but these community-driven initiatives offer a beacon of hope. By addressing the complex root causes of addiction, providing access to evidence-based treatment, and fostering a sense of community and support, we can turn the tide on this crisis. The opioid epidemic's reach extends far beyond the individual, casting a long shadow over the economic well-being of communities and the nation as a whole. The costs are staggering, reverberating through every facet of our society, from healthcare and lost productivity to the strain on social services and the erosion of our workforce. Lost productivity is one of the most significant economic impacts of the epidemic. Individuals struggling with addiction often find it difficult to maintain employment, leading to decreased workforce participation and a decline in economic output. The National Drug Intelligence Center estimates that the economic burden of drug misuse in the United States exceeds $740 billion annually. Increased absenteeism, higher healthcare costs, and decreased employee morale can cripple small businesses, hindering economic growth and job creation. The epidemic's impact on local economies is particularly devastating in rural communities already grappling with economic hardship. The opioid epidemic has placed an unprecedented strain on our healthcare system, overwhelming emergency rooms, depleting resources, and pushing healthcare providers to their limits.
Hospitals across the country are struggling to cope with the influx of patients suffering from overdoses, infections related to intravenous drug use, and a myriad of other health complications associated with addiction.
Emergency rooms, often the first point of contact for individuals experiencing an overdose, are on the front lines of this crisis. The surge in overdose cases has led to overcrowding, longer wait times, and a shortage of resources, impacting the quality of care for all patients.
The long-term health consequences of addiction, such as hepatitis C, HIV/AIDS, and endocarditis, further burden the healthcare system. Treating these chronic conditions requires specialized care and expensive medications, adding to the already exorbitant costs associated with the epidemic.
Moreover, the opioid crisis has exacerbated existing disparities in access to healthcare, particularly in rural communities and low-income populations. While the physical toll of the opioid epidemic is undeniable, it's crucial to recognize the profound impact on mental health, both for those struggling with addiction and their loved ones.
The opioid crisis has exposed a shadow pandemic, a mental health crisis fueled by trauma, despair, and the stigma surrounding addiction.
Many individuals who turn to opioids are attempting to self-medicate underlying mental health conditions, such as depression, anxiety, and post-traumatic stress disorder. The temporary relief offered by opioids masks the pain but does not address the root cause, often leading to a vicious cycle of addiction and worsening mental health.
The stigma surrounding addiction often prevents individuals from seeking help, fearing judgment and discrimination. This stigma also extends to mental health, creating a double burden for those struggling with both addiction and mental illness.
The mental health consequences of the opioid epidemic are far-reaching, impacting families, communities, and society as a whole. The opioid epidemic has cast a long shadow over the criminal justice system, leading to overcrowded prisons, strained resources, and a cycle of addiction that is difficult to break.
While the traditional approach to drug offenses has focused on punishment, there is a growing recognition that addiction is a complex public health issue that requires a more compassionate and effective response.
Many individuals struggling with addiction end up behind bars for non-violent drug offenses, such as possession or petty theft, to support their addiction. Incarceration, however, rarely addresses the root causes of addiction and can exacerbate existing mental health conditions, making it more likely that individuals will relapse upon release.
Moreover, the lack of access to adequate treatment and support services within the criminal justice system perpetuates the cycle of addiction. Many individuals leave prison without the tools and resources they need to maintain sobriety, increasing their risk of relapse and recidivism.
There is a growing movement to shift from a punitive approach to one that prioritizes treatment, harm reduction, and reintegration.
Amidst the despair and devastation of the opioid epidemic, seeds of change are being sown across America. Communities, recognizing that this crisis demands a collective response, are coming together to implement innovative solutions, offer support, and advocate for policies that prioritize public health over punishment.
One promising development is the rise of harm reduction strategies, which aim to reduce the negative consequences of drug use without necessarily requiring abstinence. Needle exchange programs, for example, provide sterile syringes to people who inject drugs, reducing the spread of infectious diseases like HIV and hepatitis C.
Another crucial aspect of community response is expanding access to medication-assisted treatment, or MAT, which combines medications like methadone and buprenorphine with counseling and behavioral therapies. MAT has been proven effective in reducing opioid cravings, preventing overdoses, and supporting long-term recovery.
Community organizations are also playing a vital role in providing support services to individuals and families impacted by addiction. We stand at a crossroads, a pivotal moment in America's battle with the opioid epidemic. The stories we've shared, the faces we've seen, the statistics that paint a stark picture of loss and despair. Yet, amidst the wreckage, glimmers of hope emerge, fueled by the resilience of the human spirit. We have also witnessed the transformative power of compassion and the inspiring stories of recovery. We must choose hope over despair, action over apathy. Navigating the complexities of the opioid epidemic requires listening to the voices of expertise, those on the front lines of research, treatment, and policy.
Dr. Nora Volkov, director of the National Institute on Drug Abuse, has been a leading voice in this fight, emphasizing the need for a multi-pronged approach that combines evidence-based treatment with prevention, harm reduction, and criminal justice reform. Dr. Volkov stresses the importance of understanding addiction as a chronic, relapsing brain disease rather than a moral failing. She advocates for increased access to medication-assisted treatment, which has proven effective in reducing opioid cravings, preventing overdoses, and supporting long-term recovery.
Echoing Dr. Volko's call for a comprehensive approach is Dr. Andrew Kolodny, Medical Director of Opioid Policy Research at Brandeis University. Dr. Kolodny has been instrumental in exposing the role of pharmaceutical companies in fueling the opioid crisis through aggressive marketing practices and misleading information about the addictive potential of painkillers.
Dr. Kolodny advocates for stricter regulations on opioid prescribing practices, increased funding for addiction treatment and prevention programs, and holding pharmaceutical companies accountable for their role in this crisis.
Addressing the opioid epidemic requires a multifaceted approach, and policy plays a critical role in shaping a more effective and compassionate response. Lawmakers at all levels of government have a responsibility to enact policies that prioritize public health, expand access to treatment, and support communities ravaged by this crisis. One crucial policy intervention is expanding access to Medicaid, which provides health insurance coverage to low-income individuals and families. Medicaid expansion has been shown to increase access to addiction treatment and reduce overdose deaths, particularly in states hit hardest by the epidemic. Another critical policy area is criminal justice reform. Instead of incarcerating individuals for nonviolent drug offenses, we must invest in diversion programs that connect people with addiction to treatment, counseling, and support services. Drug courts, for example, offer an alternative to incarceration, providing individuals with the opportunity to address their addiction and rebuild their lives. While policy and research are essential components of a comprehensive response, the power of human connection, the strength of community, and the unwavering belief in the possibility of recovery are equally vital in combating the opioid epidemic.
Across the country, communities are coming together to offer support, reduce stigma, and create pathways to recovery. From peer-to-peer support groups and recovery residences to faith-based initiatives and harm reduction programs, these grassroots efforts are making a tangible difference in the lives of individuals and families struggling with addiction. The simple act of listening without judgment, of offering a hand up instead of turning away, can have a profound impact on someone battling addiction. Creating spaces where individuals feel safe to share their struggles, to seek help without shame, and to find support on their journey to recovery is essential.
The opioid epidemic has reminded us that we are all connected, that the well-being of one affects the well-being of all. By fostering a sense of community, by embracing empathy and understanding, we can create a more compassionate and supportive environment where recovery can flourish. Choosing hope, igniting action, writing a new chapter. The opioid epidemic demands a sustained and multifaceted response. It requires a shift in perspective, viewing addiction as a chronic brain disease needing compassionate treatment.
We must move beyond stigma and embrace empathy, recognizing addiction can affect anyone. Create spaces where individuals feel safe to seek help without judgment.
The stories and faces serve as a call to action. Choose hope over despair, action over apathy. Transform this crisis into an opportunity for healing and renewal.